African Americans are 15 times more likely to develop glaucoma that can lead to blindness. The innovative treatment, trabecular bypass, can help to prevent blindness. Here to tell us more is Dr. Daniel Laroche, Director of Glaucoma Services and President of Advanced Eye Care of New York. Thank you for joining us.
Thank you. It's a pleasure to be here.
I was really astonished to learn that more African Americans suffer from glaucoma. Why is that?
African Americans have a 4-time higher prevalence of glaucoma and a rate of blindness that's about 8 to 15 times higher than Caucasians. The reasons for that is multifactorial. One, lack of access to eye care because of lack of insurance. Lack of access to the treatment. These are eye drops here, 1, 2, 3, that are commonly used for glaucoma. They cost anywhere from about $30 to $300 a bottle.
Oh.
And so sometimes people can't afford it. These bottles you have to take multiple times a day, and sometimes people forget. And so medications can help slow down the progression, but people can continue to become lose vision and become blind. Also, cataract surgery is an important part of glaucoma. Taking out the cataracts early helps to lower the eye pressure. And we have a 30% decreased access to cataract surgery according to the Medicare database compared to our white counterparts. So those are some of the barriers. And then also there are some genetic differences. There are some genetic predispositions as well.
Which is really just interesting. So is it, look, you've given me all these reasons that more African Americans, but do you not realize that you're having this problem with eye pressure? Do you not, do a lot of people not even know it?
Okay, glaucoma is a silent thief of sight. It slowly takes away your vision, usually because of elevated eye pressure, and you don't feel it. A quick test that someone can do at home right now is cover one eye, see how you're seeing, and then cover the other eye. And then sometimes you'll see if there's a big difference, you should definitely get it checked right away for glaucoma. That's one. Two, you want to get a comprehensive.
How blurry the vision is, or what? How, what?
Usually there'll be a lot of darkness in the peripheral vision.
Okay.
And it'll be very dark in one eye compared to the other. That's a crude test. But more specifically, people should get a comprehensive eye exam from the eye doctor, and they want to get the eye pressure checked. The eye pressure, just like blood pressure, the eye has a pressure. The normal pressure in the eye is about 15. 15 or less, you're pretty safe. The mean pressure in patients with glaucoma is about 18. 18 or higher, you really have to have a high suspicion for glaucoma and have a very thorough examination.
And let's talk about just when we talk about unchecked glaucoma, it is inevitable that you're going to lose your sight.
Yes, not everybody with glaucoma loses their sight because there's different rates of progression. Some people progress very slowly. In our community, we tend to progress very fast. The fast progressors, people that really lose vision rapidly, we want to intervene earlier to help prevent that from happening. And that's where screening comes in. Screening comes in is very important.
So let's talk about, we get the screening, you've got glaucoma, or you have a predisposition towards it. What do you need to be doing?
Okay, my approach to glaucoma has changed to early cataract surgery. This is the eyeball here, and inside the eye you have a lens, okay? With age, this lens gets bigger and forms a cataract by about 30 to 40%. That compresses the drainage angle, compresses the outflow, and causes elevation in the eye pressure. We know now by doing earlier cataract surgery and trabecular bypass with the Omni system, this is a device here that we use that inserts that after cataract surgery, we can open up the drain inside the eye, and that lowers the pressure dramatically. Cataract alone lowers the pressure by about 5 points, and with the Omni system by about 3 points. And by doing that earlier on, we can help preserve vision, reduce the amount of eye drops people are on, and really change the rate of vision loss to make it much slower to preserve vision and prevent blindness.
And I understand that you talked about these surgeries. You have really perfected a specific surgery. Talk a bit about that one.
Okay, well, the Omni system is my initial treatment that I'll go to with cataract surgery and trabecular bypass. But then some people, that's not enough for some people. There's a different type of surgery called suprachoroidal surgery, where we have to insert a separate tube to enhance suprachoroidal outflow to lower the pressure. It has a very good safety profile and works well to lower the pressure as well to preserve vision and minimize complications from traditional glaucoma surgery.
Okay. So anyone listening to this interview, maybe they've had someone with glaucoma in their family. Maybe they're aging. Maybe they're having issues with their vision. What do they need to do?
I recommend that they get their eyes checked out and find out what their eye pressure is. Get a complete eye examination. If your eye pressure is around 15 or less, you're probably safe. If it's 18 or higher, you're probably going to need to see a glaucoma specialist or someone that's experienced with cataract surgery and trabecular bypass. That's very important because those people will be able to offer you earlier intervention to help lower the pressure, reduce dependency on medication, and preserve your vision.
And are we talking about, because people ask this question all the time, do they need to go to an optician or an ophthalmologist?
Okay, excellent question. An optician is someone that makes glasses, okay? That's all they really do, they make glasses. An optometrist is someone that can perform eye examinations and provide medications and treatment, but they cannot do surgery. Ophthalmologist is an IMD that is also able to do surgery. But even with ophthalmologists, there are many ophthalmologists that don't operate. They just see patients medically. So you want to identify an ophthalmologist that's comfortable and very good at cataract surgery, microinvasive glaucoma surgery with trabecular bypass, and with these systems like the Omni as well, because they'll be able to offer you that treatment when the time is right after that conversation between you and the doctor.
And can I also ask you, we started this conversation talking about African Americans being more at risk. Some of the reasons, lack of health care, they don't have the resources, the money. What is your suggestion for someone who may be listening to this and they may have some eye issues, but when they hear you say, eye drops can be $30 or more a bottle, they're like, I can't do it. What do you suggest they do?
That's a very challenging situation. I mean, obviously, any way you can get health insurance, that's going to be good. If you do have a diagnosis of glaucoma, you can ask your doctor about earlier surgical options to reduce dependency on these expensive medications, and particularly if it's hard for you to afford them in that respects. Because these surgeries that I mentioned to you with early cataract surgery and trabecular bypass are covered by insurance, okay? So if you can get that. And if someone does fall under the poverty level, you can get Medicaid insurance and access some of that as well. So there are ways to do that. If you're stuck and you do need to take some of the expensive medications, some of the companies have rebate programs. You can apply for the rebate programs as well.
Okay. Dr. Daniel Laroche, thank you so much for spending the time explaining these to us, explaining glaucoma to us and this afternoon. I'm going to send people to your website, advancedeyecareny.com.
Thank you.
And hopefully we'll get a chance to speak with you again. Thank you very much.
My pleasure. Thank you so much.
All right. Bye-bye.
Okay.
Sandra Bookman, and Here and Now. We'll be right back.